Guys, so today we are going to discuss how is anxiety treated, right? So the anxiety disorders are generally treated with psychotherapy, medication, or both, right? There are many ways to treat anxiety, and you should work with a healthcare provider to choose the best treatment for you, right? So let's just go to the first aspect, which is psychotherapy, right? So psychotherapy or talk therapy can help people with anxiety disorders, right? To be effective, psychotherapy must be directed at your specific anxieties and tailored to your needs, right? So guys, the first one is cognitive behavioral therapy, right? So cognitive behavioral therapy, which is also called as CBT, is an example of one type of psychotherapy that can help people with anxiety disorders, right? It teaches people different ways of thinking, behaving, or reacting to situations to help you feel less anxious and fearful. CBT has been well studied and is the gold standard of psychotherapy altogether, right? Exposure therapy is a CBT method that is used to treat anxiety disorders, right? Exposure therapy focuses on confronting the fears underlying an anxiety disorder to help people engage in activities they have been avoiding, right? So exposure therapy is sometimes used along with relaxation exercises as well, right? Now let's discuss the second aspect of therapy, which is acceptance and commitment therapy, right? Another treatment option for some anxiety disorders is this acceptance and commitment therapy, which is also called as ACT, right? So ACT takes a different approach than CBT to negative thoughts, right? It uses strategies such as mindfulness and goal setting to reduce discomfort and anxiety. Compared to CBT, ACT is a newer form of psychotherapy treatment. So the next one is medication, right? So medication does not cure anxiety disorders, but they can help, let's say, relieve the symptoms, right? Healthcare providers such as psychiatrists or primary care provider can prescribe medication for anxiety, right? Some states also allow psychologists to who have received specialized training to prescribe the psychotic medications, right? So the most common classes of medications used basically to combat this anxiety disorders are antidepressants, anti-anxiety medications such as benzodiazepines and beta blockers, right? So let's just discuss the first one, which is antidepressants, right? So antidepressants are basically used to treat depression, but they can also be helpful for treating anxiety disorders, right? They may help improve the way your brain uses certain chemicals that control mood or stress, right? You may need to try several different antidepressant medicines before actually finding the one that improves your symptoms, or let's say has a manageable side effects, right? So that's about it. It's also observed that antidepressants can take several weeks to start working. So it's important to basically give the medication a chance before reaching a conclusion about its effectiveness, right? So if you begin taking antidepressants, do not stop taking them, let's say, without the help of a healthcare provider, right? Your provider can help you slowly and safely decrease your dose, right? Stopping them abruptly can cause withdrawal symptoms as well, right? So yes, in some cases, children, teenagers, and adults younger than 25 may experience increased suicidal thoughts or behavior when taking antidepressant medications, right? Especially in the first few weeks, right? After starting, probably, right? Or even when the dose is changed, so that happens, right? Because of this, people of all ages taking antidepressants should be watched very closely, especially during the first few weeks of treatment, right? Now let's discuss the second medication, which is anti-anxiety medications, right? So what happens here? Anti-anxiety medications can help reduce the symptoms of anxiety, panic attacks, or extreme fear and worry, right? The most common anti-anxiety medications, they are called as benzodiazepines altogether. Although these medications are sometimes used as first line treatments for generalized anxiety disorder, they have both benefits and drawbacks as well, right? So benzodiazepines are effective in relieving anxiety and take effect more quickly than the antidepressant medications, right? However, some people build up a tolerance to these medications and need higher and higher doses to get the same effect, right? Some people even become dependent on them, even that happens, right? So to avoid these problems, healthcare providers, they usually prescribe benzodiazepines for shorter periods of time, right? So, if people suddenly stop taking benzodiazepines, they may have these withdrawal symptoms, right? Or their anxiety may return. Therefore, this benzodiazepine should be tapered off slowly, right? Your provider can help you slowly and safely decrease your dose, right? Now let's move to the third medication, which is beta blockers, right? Although beta blockers are most often used to treat high blood pressure, they can help relieve the physical symptoms of anxiety, such as rapid heartbeat, shaking, trembling, and blushing, right? These medications can help people keep physical symptoms under control when taken for shorter periods, right? They can also be used as needed to reduce acute anxiety, including to prevent some predictable forms of performance anxieties as well, right? Now let's move to the fourth medication, which is choosing the right medication. So let's discuss that aspect, right? So some types of drugs may work better for specific types of anxiety disorders. So people should work closely with healthcare providers to identify which medication is best for them, right? Certain substances such as caffeine or some over-the-counter cold medicines, illicit drugs, and herbal supplements may aggravate the symptoms of anxiety disorders, or let's say interact with prescribed medication, right? People should talk with a healthcare provider. That's first thing. So they can actually learn which substances are safe and which one to be avoided, right? So that's there. Now, choosing the right medication, or let's say the medication dose, the treatment plan should be done under experts care and should be based on person's needs and their medical situation, right? So that's very important. Your as well as your provider may try several medicines before finding the right one. Even that can happen, right? Now let's discuss the third aspect, which is the support groups, right? So what happens here? Some people with anxiety disorders might benefit from joining a self-help or a support group wherein there is sharing of their problems and achievements with others, right? So these support groups are available both in person and online, right? However, any advice you receive from a support group should be used very cautiously, right? Because and it should not basically replace the treatment recommendations from a healthcare provider. One should be cognizant of that fact, right? Now the fourth aspect is stress management techniques, right? So what happens here, right? So in stress management techniques such as exercises, mindfulness, and meditation basically also can reduce anxiety symptoms and enhance the effects of psychotherapy, right? You can learn more about how these techniques benefit your treatment by let's say talking with your healthcare provider. You can do that, right? So that's about it, guys. I'm so thankful to you to watch this video. I hope you enjoyed it. Thank you so much, guys.